Well, hello to everybody here on this webinar. It's titled Clinical Lifestyle Medicine, FST, a new breakthrough in frequency, sequence, and color therapy. And I have my good friend and colleague, Dr. Debbie Weiss. Why don't you say hello, Debbie, now that we have the recording going?
Good morning, everyone. Thanks for spending a couple of an hour and a half with us this morning. We really appreciate your time and attention. Thank you.
We truly do. This is such amazing information that we're presenting. But one thing about this aspect about vibrational medicine and lifestyle medicine is that these are rapidly growing fields. And it's a very good thing for you to invest into is gaining your expertise in these areas, because something that's going to grow in terms of an economic level, on a social level, will be something that meets expanding needs of people. In terms of business, you always want to think about where's the trends in society going? Where's the trends of people in my area? Like, what are new needs that are not being fully met? In fact, in business, that's often called underserved needs. So think about that. Let's say in the realm of healthcare or even aesthetics, what are the underserved needs of people in your area? And I've analyzed this a lot, and Debbie and I both have studied a lot about this, and I truly believe that helping people with chronic diseases and chronic pain and lifestyle issues like being overweight and dealing with all these metabolic diseases like diabetes and different kinds of endocrine disorders and mental, emotional stress disorders. These are the fallout of rapid change on our planet and a lot of stressors and toxins that in the environment that didn't exist in our parents' generation in the same way. So if you have a really powerful and valid solution to that that can consistently help people, that is a very good thing to invest into. So what we're really doing is, of course, how do you invest? You invest with your time, with your attention, with your study, your working with it in your clinic, getting trainings, possibly getting equipment, like whatever it takes to do that, learning about new supplements.
Okie dokie. Thank you. Well, lifestyle medicine is really, I believe, has always been the basis of traditional Chinese medicine and many traditional medicines, in as much as I think we have known for a very long time that what we do on a daily basis affects our health and wellness. So, Darren, when you were talking a little bit earlier, a few minutes ago, about the trends and trying to be cognizant of and then stay ahead of and being able to provide for people in need, lifestyle medicine is really a major issue at this point. And what do we really mean by lifestyle diseases? Well, really, cardiovascular disease, diabetes, and cancer are all fueled by the same preventable risk factors. This is a quote by Dr. Mark Hyman. Those risk factors being hypertension, elevated blood lipids, sugar, obesity, physical inactivity, and smoking. And he goes on to say that medications do not address the cause of our afflictions. And we all know that, but sometimes I think it's important to actually just see it in print. And what they have found now, the most recent research that just got called, is that obese numbers outweigh the merely overweight in the U.S. So not only are we not losing weight, we're actually gaining more weight. So why does all of this matter, and what does this have to do with chronic inflammation? Well, what we're really finding is that chronic inflammation is increasingly linked with health issues, obesity and autoimmune issues. And what creates this chronic inflammation? What puts the immune system in overdrive, which is really what chronic inflammation is. It's a constant kind of heat or fire in the body. So for anybody who practices Chinese medicine, we can think about that in terms of heat and fire. And what happens with chronic inflammation is the immune interruption of cell function. It just really creates a lot of dysfunction within the cell walls, and this generates an internal swelling and tissue irritation. And where does this come from? It comes from our diet, our standard American diet. Genetically modified food, that's a lot of the concern with GMOs right now, is that they're leading to some kind of an inflammation and actually changing the DNA of the gut bacteria.
Let's talk about the clinicals. What do we do about all this stuff now?
What do we do about it? And as healthcare practitioners, what can we do about it? We do have many, many different tools to use. We've got the Mushu color that we can incorporate. Mushu color with specific microcurrent frequencies, blending those two together, which is something that will be a highlight out at LA seminar, is how do we choose now specific frequencies to put into the Mushu color treatment strategy. And then we have taken that a step beyond that, and we're saying, well, as long as we're doing Mushu and O-ring testing, how can we now take and use that information to really shore up what our nutritional or supplemental or herbal formulas and supports might be for people? So we get a lot of information with that Mushu technique that's pretty exciting. And then FST, frequency sequencing therapy. We have now the tablet, which can be put onto the Accutron. We just got a glimpse of that last year out at LA. And, hats off to you, Darren, and your team of engineers for working out the kinks in that, because I've been using it now for almost a year, and it has dramatically streamlined my ability to use FST in the clinic. So we will be introducing a lot more of that out in LA as well. But the ability to actually program in a series of frequencies, a sequence of frequencies, and push the button and let it go is really phenomenal. And I think you're going to talk a little bit more about that at the end of this webinar, right?
Yes.
Okay. So we've got that. And then combining FST and acupuncture. The Ideal Weight Program, which really is, in my clinic, I term it the Ideal Weight and Lifestyle Program, because it takes everything that we've just talked about with lifestyle and puts it into a more concise package. And then PNE balancing for mental, emotional issues. So really, in terms of lifestyle medicine, we have listed here, seven clinical approaches to dealing with folks when they come in with anything from chronic pain to type 2 diabetes to obesity, that we have some very good cutting edge and clinically tried and true therapies that we can offer.
So let's go through some of these different clinical modalities so you can learn more what they are. So what frequency sequence therapy, FST, is running a series of frequencies with microcurrent, or you could use radio waves. I mean, like Rife generators use radio waves, and there's other ways to do it, but microcurrent seems to be the most beneficial way to apply frequencies because microcurrent by itself has many healing properties. I think if you go to our website, eastwestmed.com, you'll see a whole list of research studies that show how microcurrent accelerates tissue healing and regeneration, wound healing that come from many different journals. So microcurrent by itself already has that effect. And then microcurrent also is an ideal way to stimulate acupuncture points and meridians because they have a very strong electrical nature already. I've also found that microcurrent is excellent for treating emotions through the chakras, through what Debbie called PNE balancing. So what this is taking it another step further, that when you run a series of frequencies through the microcurrent, they can either be applied right through acupuncture points, like the Mushu technique she was talking about, or there's more general ways to apply it to the whole body. I know, Debbie, you do a lot of using the 4 gates, or we also like there's a lot of ways to apply it to whole regions of the body. And with the new module that we've released, you can just run it unattended. You just set it up and leave the room, and it just runs over 10 to 40 minutes, depending on the treatment. So every aspect of the human body resonates with certain specific frequencies. This is called the law of resonance. It's one of the universal laws that governs all matter and everything in the universe, basically, that so much of what's going on in the physical universe and the energetic universe has to do with resonance. What's resonating and which frequency field is entraining other things to come into its field, or how those frequencies are affecting each other. So when these frequencies are applied to the body, the target area that you're applying it to may respond by boosting its energy level or balancing its yin-yang energies. And it happens on the physical level. So that's one thing, so people with chronic fatigue and fibromyalgia and a lot of degenerative conditions have too low of an energy level in many areas of their body. So when you resonate with it, certain frequencies will raise the energy level, like 49 hertz for vitality is an example of that. Now, the other thing microcurrent does with frequencies is balancing the yin-yang energies. And it can accurately be said that all medicine is balancing yin-yang. How do you like that one sentence secret, Debbie?
You know, it's very true, and I agree with it, because the way of articulating that in Western medicine is to say it lends to homeostasis. Homeostasis is the Western terminology for yin-yang.
So frequency medicine is actually probably the most powerful way to help the body to come back into homeostasis or yin-yang balance. Now, one of the things that we are focusing on now is that Debbie has focused most of her study of microcurrent into studying these frequency sequence therapies. She's been focusing more on that part of it, and my studies have gone in a different direction with microcurrent. I focus more on how you stimulate acupuncture points and chakras with microcurrent and light. So our research has been in somewhat different directions, but what we've been doing lately is combining these systems together. For probably about a year or more, we've been working with that. And it is, I know the word awesome is overused, but I'm going to use it now. It's awesome. When you take that kind of more unattended, let's say, broad treatment of the body with series of frequencies, and then you use the probes, let's say of an Accutron unit, to stimulate acupuncture points, Mushu of organs, and chakra points, it's an amazing combination because they work in different ways, but they really complement and strengthen each other. So here's some examples of that. Like I gave you the example of 40 hertz for inflammation combined with 396 for nerves and 10 for spinal cord. So you could have that running in the background with pad electrodes, and then while that's happening, you could take your probes, having the person lay face down, and work down their spine with a series of colors and what I call the spinal autonomic balance treatment. And that's a remarkable combination. And you could even put in needles, say in extraordinary vessel points while you're doing that.
Now taking all of this another step beyond just simply saying what one protocol do I use and always use that, it's being able to say the next step is what strategy can I use, of looking into this toolbox of multimodal modalities and picking the ones that clinically seem to be warranted at that clinical visit.
I love the term used of toolbox because I use tool belt since I used to be a carpenter and a framing carpenter, so I had a tool belt. But you could say toolbox, but that's really what the art of practice of medicine or alternative medicine is you want to assemble the most powerfully effective tools you can, like the ones that have the highest possible effectiveness. But then the big art is learn what to use when on which patient. So you can run these solfeggio frequencies through pad electrodes on the body combined with chakra balancing. You could run them through ear clips, through the one on each lobe of each ear. That's used a lot for working with the brain and emotions and the nervous system. You can also use them with the spinal autonomic balance. So Debbie, I know you have some really good case histories you want to present. So why don't you explain those to us of how these are worked in your practice?
Yeah, these are pretty fun. This one we entitled the Mini Mushu Battlefield Acupuncture and FST. And so a woman recently was referred to my clinic by a Lyme literate physician in Rochester, Minnesota. This woman is 52 years old. She has severe, pretty much unrelenting whole body pain and unbearable tinnitus. And it was really the tinnitus that got her doctor to refer her to me. The current protocol that she's on is just extensive use of antibiotics and oxycodone. I mean, this woman came in with 8 pages worth of medications that she was on. She's on a pretty heavy plan of antibiotics to try to deal with some very embedded Lyme issues. The patient routinely disconnects. She really can't have much of a conversation. It's really her husband constantly finishes her sentences. It was her husband who initially called the clinic and set up the appointment. This patient is very irritable and she's profoundly sad. She is a registered nurse. She's a flight attendant, hasn't worked now in a couple of years. She used to run 5 miles daily. So she is profoundly sad over the turn her life has taken. She got diagnosed formally with Lyme's about 3 years ago, but it's estimated that she probably contracted it 15 years ago. So you can see that before she ever got any treatment, she had about 12 years where this was ravaging her body and leaving her with some pretty significant neurological issues. This is always kind of a tough case to see come into the clinic. Next slide, Darren. So you look at this and you kind of go, oh my God, what do I do? Okay, well, what I really did with her was, at least initially, we needed to deal with this pain, but also with the tinnitus, because the tinnitus was driving her crazy. There were many times during the day, and especially at night, where she would have to wear headphones with music playing on an iPod because it was the only thing that would distract her from this constant ringing in her ears. We did a mini Mushu, and I tested just liver and kidney, and they both tested off. Why did I use just liver and kidney? Well, for one, I was a bit crunched on time here. You can imagine the amount of time it took just to interview these people with a lot of the cognitive issues that were going on with her, and so I was starting to get a little crunched for time. So I just tested liver and kidney, but why liver and kidney? Well, because of the pharmaceutical she's on, I was very concerned about the health of her liver. And I always view liver and kidney as probably the 2 primary functional organs to at least pay attention to initially. So because of the pharmaceuticals, the liver, she also talked about a lot of irritability. She has a tremendous amount of liver qi stagnation, put it that way, that I think is from Lyme's, but also pharmaceutically induced. And then kidney, because we know that the kidney rules the brain and the ears. I wanted to give that a test with the Mushu and the O-ring testing because of her cognition issue and the tinnitus again. So I just briefly tested those. Both of those points were extremely weak, but they tested strong with the colored green. Again, I always start out with green when I color test because it's in the center of the fulcrum. It's the fulcrum of the color spectrum. So when we talk about homeostasis or yin-yang balance, pretty much, you know, green is in the middle, right, Darren? It is the most balancing color.
It's the great balancer,
so it may not, right, it's a great balancer. It may not necessarily be the most therapeutic, but it's always a great balancer. And so it's the one I at least start out with. And I found out, interestingly enough, it didn't surprise me that green tested strong for her liver. It did surprise me that it tested strong for her kidney. So anyway, I just took the probe and with green, with the green slide, and for the liver, I added in the frequency of 35, which is the frequency for the liver. And I did the little 6-second treatments, and I did 4 of those to her liver, and then tested her liver, O-ring test again for her liver, and it tested very, very strong. Then I moved on to her kidney, and I did the same thing using the green, except I changed the frequency to 23, which is the frequency for the kidney. And that took 5 little 6-second treatments before that tested very strong again. So I got some color into her. And then I needled her ears bilaterally with the Battlefield protocol. And I didn't use the tack needles. I just used my regular 40-gauge needles that I typically use. Did the Battlefield protocol in each ear and added in yin tong. And then I put her pads. I put pads for channel A at kidney 1. with the intensity of 50 microamps, and I ran 528 hertz for the frequency, biphasic. And what 528 is one of those solfeggio frequencies you just mentioned, Darren. 528 is a beautiful frequency for transformation. And I thought, boy, if we wanted to do anything in this treatment, we wanted to transform what she walked in with. So that was my treatment. I would say the overall treatment time for this took me about 10 minutes to do this, to do the O-ring testing, the Mushu, treat with the probes, put in the acupuncture, and get the pads going on kidney 1 was probably 10 to 12 minutes. I ran this protocol, left the acupuncture in and the microcurrent for 20 minutes. I then went in and I turned off the pads, turned off the Accutron, pulled all of the needles, and I just let her rest for another 10, 12 minutes. And on the next slide, that's the treatment. So this was about a half hour, I would say 35-minute treatment is what this took. And on the next slide, we show that she talked about having an immediate pain level of reduction of 50%. And that we've done this treatment now 3 times with her, but she has said that she has had diminished pain for 1 to 2 days, significant diminished pain for 1 to 2 days after the treatment, and that when she does take her oxy, she's usually able to take a little bit less of it and not take it as frequently. So that's a huge benefit for her. The bilateral tinnitus decreased by 50%, which was for her life-changing. That was almost more life-changing than the pain control, and that she was able to get that decrease for 2 to 3 days. She started to get a gradual return up to about 85% of what she originally had. She had better resolution in her right ear, and that she was starting to be able to sleep more often without headphones on. Her cognition has cleared at least immediately. After these treatments, she's able to walk into my office and schedule her own appointment. She doesn't need her husband to help her do that. And that's dramatic. And she takes, to her, that's a significant indication that she can get better. She's so proud to be able to book her own appointment and not have her husband do it for her. Her affect changed, where she walked in being really irritable and pretty cranky to just being brighter. She talked about not feeling so overwhelmed. She would say she feels lighter and brighter. And again, that when she has these treatments, she starts to feel hope, and it's really the only time she feels hope. So this has been a really humbling experience to treat her, but also very exciting from a practitioner point of view to realize that there are various treatment modalities that I can pull from Johnny on the spot to put together a treatment strategy on the spot and have some very successful outcomes with it.
So anyway, thank you for presenting that case history. That's a perfect example of this approach, and thank you for sharing it. Mm-hmm. And so next, I know there's another new thing that Debbie has been experimenting with. She and I both do a lot of work with extraordinary vessels. And that's something I've studied a lot of the Japanese acupuncture and I studied with Kiko back in the early 80s and other people and Dr. Manaka. But this is a new approach that combines needles with microcurrents. So why don't you talk about that, Debbie? This is exciting stuff.
This has always been my favorite acupuncture treatment, my favorite acupuncture protocol. What I've started to do is use microcurrent on some of the combinations. Instead of needling them, I put a pad on and I feed that point with the frequency of 10 hertz, which we know is for the spinal column, but it's also a very universal frequency. I would do an assessment of the extrameridians and then put some microcurrent to some of them, needle the remaining points, and usually the treatment time is about 25 minutes. I'm so excited because I've loved the Jing treatment for so long, and people have probably heard me talk about the Jing treatment for years now. But adding microcurrent in has just been a real thrill. So here we have a 67-year-old, a very healthy woman who was referred in to me by her Pilates instructor. So if you want to think about marketing, there you go. 4 years ago, she developed a very severe sciatica, and that just kind of resolved in 2 years. But when that resolved, she ended up with a limp. And it's kind of a mystery. She got a diagnosis of spinal stenosis. She doesn't have any pain, but she developed this limp and a weakness of her left foot and leg, and almost like a foot drop in that foot. And that's part of what got her to go to Pilates, because she thought she could really strengthen it. She had been to PT. She was going to Pilates. Her limp had her walking, almost waddling, I should say, like a duck, you know, kind of side to side, because she couldn't really move forward very well. She couldn't move forward in a straight line. She would have to waddle forward. Her balance was off. She couldn't balance on her toes or her heels. She couldn't stand on her tiptoes. And she got toe cramps at night. So this was a very interesting situation. Next slide. Okay, so what I did was I thought about the Jing treatment, because again, it's a very balancing treatment. And I took a closer look at it, and I thought, well, what extra meridians are really affected here? And I decided it was the yin and yang Chao vessels, the kind of forward and backward. Those vessels give us forward and backward movement. So I initially, for the first couple of treatments, I just did the Jing treatment. I just needled her to see what kind of effect we would get from that. Total treatment time, 25 minutes. So I ran the microcurrent for 25 minutes. I also prescribed for her a magnesium lotion for her feet at night, so she could get some magnesium in there for that tissue. We treated once a week for a total of 6 weeks, and then we did one more treatment a month later. What happened when we did this? Well, for the first treatment, so for treatment number 1 and number 2, I did just the Jing treatment. She noticed that she was better able to walk upright. She had a little less shifting to her. So that acupuncture treatment was effective. There was no doubt about it. She came in for treatment number 3, and she didn't have any setback. She was continuing to walk a little bit more stable, and I just felt like we needed to ramp up this treatment a little bit. So that's when I decided to add in the microcurrent. So for treatment number 4, I added in the microcurrent. And when she came back for treatment number 5, she said she had a dramatic improvement. To her, it was as if she never had the problem to begin with. She was astounded. Very simple treatment, very, very simple treatment.
So a little more about Mushu. I'm delighted that you're using more Mushu, Debbie, and by propagandizing you for all these years, it's finally paid off.
Yeah, it's finally rubbing off on me, I'll tell you. My belief, and I think you can correct me if I'm misguided on this, but I always have felt like the Mushu color treatment immediately feeds or balances the identified organ system. You get kind of this immediate correction. Talk about color hunger. And,
right.
Color is why color? Well, color is its frequencies, right? We're just seeing it in color. So, based upon the presenting symptom and the color hunger of the system in need of support, I have taken, and I will start now differentiating which nutritional supplement or herbal formula I want to prescribe to support that particular organ until the next treatment and next evaluation. So not only, if we're going to go to the work to do the Mushu and the diagnoses, we may as well also benefit from using that information to start differentiating and being able to prioritize the most effective formula or supplement that we want to give to then continue to enhance that organ system.
Yeah, this idea, we're going to develop this a lot more in our teaching moving forward, is how you test, you bring an energetic input into the organs through testing, which is color and frequency and in some cases sound, and then you use the same point to test for the physical supplementation. Again, this is part of the whole treatment system. The final slide we want to say is the overview of the LA seminar protocols. Again, we chose 10 of the most common challenging type of conditions that people are confronted with who are in clinic. And that would be chronic pain, neuropathy and post-stroke, anxiety and phobias, Shen disturbances, which is connected with many mental and emotional illnesses, addictions, chronic fatigue, which is the flip side of fibromyalgia, insomnia, headaches and migraines, obesity and diabetes, this very well proven out weight loss program, and then leaky gut and irritable bowel syndrome and detoxification. So we're going to be giving you very comprehensive protocols for all of these conditions using the approach that we've been talking about in the seminar. But it's not just about giving you a cookbook. You're going to really learn how to use your toolbox and choose intelligently which parts of the tools to use for which patients, and as much as possible be doing hands-on. And
I think, yeah, to that point, our mission, our first bullet point on this slide is what is the mission of the LA seminar? You know, are there protocols? Yes, but the mission is to empower the practitioner. You know, I've gotten some really interesting feedback from some of you who have attended live stream and at seminars directly. And another aspect that people want help with, aside from protocols and things, is, you know, how do you talk to patients about, how do you explain to patients what you're doing? What lingo do you use? Or how do I really market this? And so we'll be getting much more into depth of that in LA as well. And it's not going to be so much that we're going to set aside an hour to talk about it. From my perspective, I will be talking about marketing throughout the entire seminar. You know, if an idea pops into my mind, like the Pilates instructor, which I just mentioned, you know, there's another marketing idea. Who are you networking with? So for those of you who have given us that feedback, we take your feedback to heart, and we'll make sure that we are giving you as much information as we can to empower you as a practitioner. That's really, I think, in the heart of both Darren and I and Joanne East-West seminars, is to make sure that as practitioners you feel empowered and supported. You know, I've had 2 Accutrons now for 10 years, and audience, he really doesn't pay me to say this. It's just true. There's a reason that I've, you know, kind of collaborated with Darren. I've had 2 Accutrons for 10 years, and I would say I use my Accutrons in 95 to 98% of the treatments that I do on a daily basis. I really use it a lot. And the Accutron in doing microcurrent has transformed my practice. I can't imagine my practice without it.